Hi, I'm Kevin Captain, Volusia County's Community Information Director, and I'm here with Dr. Peter Springer, who is the Emergency Medical Services and Operational Medical Director for Volusia County. Dr. Springer is a board-certified emergency physician with over 25 years clinical experience. Dr. Springer is also the Clerkship Director for Emergency Medicine for Florida State University's College of Medicine. How are you, Dr. Springer?
I'm doing well, thank you, Kevin.
Well, thanks for being here, and I will mention that we are greater than 6 feet apart from each other, so
yes, we are.
We can safely have this conversation without our masks, and we're both fully vaccinated.
Absolutely, we sure are.
Governor DeSantis has been spearheading the provision of monoclonal antibody treatment sites. And we happen to have one here in Volusia County. It's in Ormond Beach at the Ormond Beach Senior Center, which is at 351 Andrews Street. So, Dr. Springer, first off, what is monoclonal antibody treatment?
Well, that's a great question. I think we probably need to start with what are antibodies. So everyone in this world has antibodies. And what antibodies are? They're specific proteins in our body that help recognize foreign bodies that present into our system. The most common being viruses and bacteria. So what our body does is when we have a bacteria or a virus that invades our body, like the common cold or unfortunately now COVID-19, our body uses the antibodies that are naturally in our system that will recognize the foreign invader, i.e. the bacteria or virus. So what happens in that process is our body will recognize that there's something that's foreign to our body and mount an immune response, which means that it's going to mount a response that fights that virus or that invader to hopefully get it out of our system or out of our body. So we naturally have what are called B lymphocytes that have kind of a constant surveillance action where they go through our system and our body and look for anything that's not natural to our system. When they recognize that, they will attach to that foreign invader and then make antibodies, future antibodies that propagate because of their initial reaction, and then further antibodies will be dispensed throughout our system, recognize if there's more of these invaders, and hopefully kill them and get them out of our body. So with monoclonal antibodies, is specifically what we're using now for our COVID-19 infections. These are manufactured antibodies that are manufactured outside in a lab, specific to the proteins that we see on the COVID-19 virus.
That's the spike.
The spike, the spike protein. So with the COVID-19 virus, there is a specific protein that's on the outer layer of that virus that is called the spike protein. And the monoclonal antibodies are manufactured to identify specifically those spike proteins, nothing else but those spike proteins, attach to them and make the cell or the bacteria or virus, in this case the virus, inactive, and so that it can't infect our natural body cells.
How is monoclonal antibody treatment administered?
Fortunately, we have a site here in Volusia County, and you mentioned the address. And it's administered either by infusion, which is intravenous through our vein, or by injection. So the infusion is just like you would receive an IV bag. You put a needle in the vein and administer this fluid through that vein. It usually takes between 20 and 50 minutes to infuse that. But you can also use injections. The downside is that it requires 4 separate injections at 4 different sites because of the volume of the monoclonal antibody.
You can't put it all in one site.
Can't put it all in one site,
okay.
Right. So the most common areas are either 2 in each arm and 2 in the stomach. Some can do it in the thighs and the stomach, but the most common out there being the arms or the deltoid muscles and then the stomach. And that's given subcutaneously, so not deep into the tissue, but under the skin.
Who should consider getting monoclonal antibody treatment?
Well, I think anyone that gets the virus actually should consider it, especially those who are unvaccinated. They have more of a chance of having a more severe infection. So unfortunately, they tend to be the ones that get sicker than those who have been previously vaccinated. Also, people who have comorbid conditions. And you hear that a lot, what's a comorbid condition? Comorbid condition is anything that could potentially make your immune system weak. Long-standing hypertension, congestive heart failure, diabetes, any of the autoimmune diseases. People are often, they're immunosuppressed because of that. Their immune systems are not as strong. And then obviously our elderly patients who are at more risk for having more severe infections.
Now, they say that in order for the monoclonal antibody treatment to be effective, it needs to be administered early on in the phase of infection. Why is that?
Well, that's because it's a great question. And the reason behind that is once the virus is in your system for a longer period of time, you have so many virus particles that it makes the monoclonal antibodies less effective and less likely to have the patient have a speedy recovery. So the earlier you get to that patient, the fewer bacteria, or in this case viruses, are going to be in your system. And it gives the chance for the antibodies to actually attach to the limited amount of viruses, in essence killing them before they propagate and you have too many in your system.
Is monoclonal antibody treatment the same as getting a vaccine, or is it different?
Definitely not the same, and excellent question. So with the vaccine, what we're in essence doing is giving the patient messenger RNA, which in turn has the body produce the spike protein that we see on the COVID-19 virus. Now that spike protein, what it will do is it'll be attacked by our natural immune system. So our natural immune system will identify that spike protein that's propagated by the vaccine and then attach to it and form further antibodies that are in our system. Those antibodies will also be in our B cells, which are specifically the memory B cells that we have, that'll always constantly survey the body for future infections of the virus. Now, the monoclonal antibodies don't produce that same immune response. What they're doing is that we're providing that patient with pre-made antibodies so that the body doesn't have to make them, and there's no process where it'll make antibodies. So what we're doing is we're giving the antibodies, they're attaching to the virus that we already have in the system, killing those virus particles before they infect further cells, but there's no longer lasting immunity like you see with the vaccination.
So your body's not producing the antibodies, you're actually passively giving the antibodies by way of that injection.
Right, and that's part of the passive immunization that we hear about.
So when you give the antibody, I mean, how long does it last? Does it last for a couple days or a couple weeks? Or?
Yeah, probably more like a couple weeks, but certainly not any longer than that. So, that's why we have to give it to patients who have either been immediately infected or recently infected by the virus, or people who have significant comorbid conditions that have been exposed to someone with the virus. Because what we're trying to do is prevent that virus from propagating or getting into the system. But it doesn't stick around. So, it's not going to be good for 2 months down the line when you possibly could have an exposure or get affected. Then you would need to have the antibodies administered again.
So if someone believes that they've been exposed to COVID and they're just starting to feel symptoms like a runny nose, headache, fatigue, cough, that's when they need to get in there.
That's when they need
treatment.
to get in. Yep, the earlier the better, and certainly it'll decrease the longevity of the symptoms. Now, when patients get to the hospital or get to the point where they require oxygen or hospitalization, that's essentially too late. So you're not going to really get the benefit from the antibodies that you would if you got it early on.
Makes sense. So, Dr. Springer, this site now has been operational for a couple of weeks. Do we know if it's working? And if we do know it's working, how do we know that? Have you seen direct examples?
Yeah, well, having worked in the ER and still working in the ER, prior to us having this site, we were seeing a significant amount of people presenting to the hospital needing admission that were very ill. Since we've had this site open, we've actually seen a steady decline in the presentations at the hospital emergency departments. These patients are now being recognized as having COVID, going to the site, getting their monoclonal antibodies, and not having to at all ever show up at the ER. So I can share with you that from a physician standpoint, I'm seeing a significant decrease in hospital admissions and hospital visits for patients who have COVID-19.
That's wonderful. We know it works, and we know that if patients get in there early, they won't have as significant of a disease course. Just know
Absolutely. Yeah. Absolutely. And just knowing that the patients that we've referred to the site, getting the feedback that they've actually done very well, usually within 1 to 2 days without symptoms after that. So we know it's working.
You can seek out treatment for monoclonal antibody. It's at the Ormond Beach Senior Center at 351 Andrews Street. Now it's open Monday through Friday from 9 to 5. Appointments are highly recommended, but they can be made at patientportalfl.com. There is not a prescription that's required at this time, or a referral is not required. And most importantly, it's free of charge.